Okay, we're going to discuss about the Chlamydia, Rickettsia, and later on we'll be discussing about your Mycoplasma. So we have here your Chlamydia. So the family of your Chlamydiaceae is divided into your genus Chlamydia, which includes here the species of your Chlamydia trachomatis, and Chlamydophila, which includes your Chlamydophila pneumoniae and Chlamydophila psittaci. In the case of your Rickettsia, so we have the order Rickettsias divided here into your family, Rickettsiaceae. This includes your Rickettsia and your Orientia. Then we have also here your Anaplasmataceae. This includes your Ehrlichia, your Neorickettsia, Anaplasma, and we have also your Cauridea and Wolbachia. Your Coxiella currently are not eventually included in this one, but we'll be discussing your Coxiella. So these two family here actually intracellular obligate parasites. So we speak about an intracellular obligate parasite can enter our cells or body, primarily your phagocytes, which try to multiply within your those cells in our body, and therefore prevent them to be removed in our system by our with your phagocytic system. Okay, so we discuss first our chlamydia. So our chlamydia primarily made up of two reproductive stage here. We have your elementary body, which is the infective stage, which is the infectious. And we have also here the reticulate body, which is the non-infectious. Okay, so basically our chlamydia try to infect your non-ciliated columnar transitional epithelial tissue, primarily found in your conjunctiva in your eyes, and even in your respiratory tract, and even in your urogenital tract, and even your rectum. Okay, so we have here the life cycle of your chlamydia. So we start here with the elementary body, which is the infectious stage, where it try to infect your tissues in any part of your body. So within that one, it try to enter your cells here, macrophages within those tissues. Okay, try to multiply, which eventually try to reorganize itself to become here the reticulate body. Once it transforms to become reticulate body, try to multiply and try to take over the metabolic functioning of the host and try to divert the host here to make its own metabolic needs. And after 24 hours, it try to reorganize itself again to become your elementary body. Then after 30, try to multiply, and after 30 hours, it stop multiplying. Then at the 35 to 40 hours, you try to lyse the whole cell here and then try to release out of that one and then try to go to the next tissue and try to, again, try to repeat the cycle. And therefore, infecting those mga non-ciliated columnar transitional epithelial tissues natin. So, on the membrane structure of your chlamydia, it's made up of the major outer membrane protein. And also, because this one would have also the presence of the LPS on its outer membrane. And the most important marker found here on the outer membrane, the LPS part, we have your ketodeoxyoctonate. The ketodeoxyoctonate here serve as the antigen primarily for identifying them when you are doing your serological testing. Okay, by identifying your antibody. With your antibodies or agent for you to detect them, so ito ang tina-target nila. So, pag ma-identify, so if you have positive for that, mean to say, okay, that's organism here, having that one, it will give a positive result for that serological test. Okay, then we have your different species of your chlamydia. So we have your Trachomatis, pneumoniae, and we have Psittaci. They can be differentiated from one another by the following. So the first one, we have your glycogen inclusion. Okay, glycogen inclusion bodies could be found only in your Trachomatis. With their elementary bodies, so we have round, pear shape, and round. Sulfa drug sensitivity. This one is sensitive, so I mean to say that would be susceptible, that will be effective for the Trachomatis, but not for this one, not for that one. Okay, natural hosts for your Trachomatis, human, pneumonia is also human, Psittaci here in the bird, Psittacine bird. Okay, human diseases with your Trachomatis, we have your trachoma, lymphogranuloma, venereum, and some urogenital infections. For the pneumonia, you try to cause here your atypical pneumonia, bronchitis, and your pharyngitis. Psittaci also cause here pneumonia and even fever of unknown origin. Di alam kung saan nanggaling. Okay, we have here, first we discuss your Chlamydia trachomatis. We consider this one as the most common cause of your sexual transmitted disease, followed by your Neisseria dockerii, Haemophilus dockerii. Okay, so, followed here by your Neisseria gonorrhea, I mean. Okay, papilloma virus, we have your Chlamydia trachomatis, then we have your Neisseria gonorrhea for that. Okay, so we have that. We have here the different diseases associated with your Chlamydia trachomatis. The first one, we have here your trachoma. Trachoma here is a chronic conjunctivitis. It's an eye infection and also the leading cause of your blindness. Get infected by that one by your hand to eye through your fomite with the contaminated na secretions or even a conjunctiva. So this is caused here by the serovarity. We have the A, B, D, E, and C. Serovarity L, L1, L2, L2A, L2B, L3 try to cause here your lymphogranuloma venereum, which is a sexually transmitted disease. So this one characterized here by the presence of manifestation symptoms related to your inguinal and anorectal symptoms. The bacteria try to enter the body here through your lymph nodes near your genitals, which eventually try to result in swelling of the lymph nodes and producing here bulbos. And later on, the lymph nodes try to rupture. Another disease here caused by your trachomatis would be the urogenital infections related to your serovarity D, D, E, F, G, H, I, J, K. Okay, so that one try to be transmitted here is a sexually transmitted and siya, urogenital infections. For the male, try to cause here your non-gonococcal urethritis, mean to say that's the urethritis infection, the urethra not related to your Neisseria gonorrhea. It also try to cause here your prostatitis, inflammation or infection in the prostate, and we have also your epididymitis. For the female, try to cause also here urethritis, endometritis, salpingitis. Also cause here your pelvic inflammatory disease, and then you have your Reiter disease. Another one caused here by your trachomatis would be your inclusion conjunctivitis, which try to occur here among the baby born out of the mother infected by the infection. So try to pass through the infected na birth canal, they can develop here an eye infection. Okay, in the form of your inclusion conjunctivitis. Plus, meron siyang nasopharyngeal manifestation and plus your pneumonia. Okay, we have your laboratory diagnosis. So, your chlamydia were able to grow here in your cell culture. So, it's not able to grow in your agar media, but rather in the cell culture in the form of mga cell lines natin. Like, for example, your human epithelial cell, your HeLa cell, your hepto. We have also your McCoy and your buffalo green monkey kidney cell. Could be identified here by non-cultured, non-amplified. Okay, so you can have here your direct fluorescent antibody testing or optical immunoassay. You could also have enzyme immunoassay. Molecular tests, you could have your PCR, DNA probe, and nucleic acid hybridization test, or serological tests in the form of your complement fixation, enzyme immunoassay, and micro-IF immunofluorescence. Okay, other tests, you can have your skin tests for the lymphogranuloma venereum. We call this one surfritis. Okay, the next one, we have your Chlamydophila pneumoniae. So, the former name of your Chlamydophila pneumoniae was then Chlamydia species substrain tuar, the TW here, and the AR. TW because the first isolate of this one has been isolated from a child in Taiwan, which is in the conjunctiva of that child which is enrolled in the trachoma vaccine. And AR naman, so this is also isolated here from someone in the University of Washington. Okay, kaya tinawag yung tuar, but eventually, of course, we call this one today as your Chlamydophila pneumoniae. So this is identified as having unknown incubation period, unknown reserva, then unknown then ang kanyang mode of transmission. So try to cause here atypical pneumonia. Okay, atypical pneumonia natin, we have your Mycoplasma pneumoniae, Chlamydophila pneumoniae, okay, and of course, that's atypical pneumonia. Okay, then eventually this one, okay, you would have your biphasic manifestation of the illness, characterized here by the first stage, characterized here by prolonged sore throat lasting for 5 to 7 days, with the hoarseness of the voice, garagal ang boses, and eventually you would have your pharyngeal flu-like symptoms in the lower respiratory tract. And later on, the second stage would be production of your pneumonia plus your pharyngeal bronchitis. There's also have increased risk here for those patients having an autoimmune disorder. This is your Guillain-Barre syndrome. Diagnosis, cell culture din ang kanyang cell, ang kanyang isolation. You cannot grow this one ordinary culture media. You just need to have here your cell lines. So hepto could also be identified with your immunofluorescent molecular tests, micro-IF, and your ELISA. Okay, then we have here your Chlamydophilus psittaci. So this one is primarily transmitted here coming from close contact with your citizen bird. So this one try to cause here your psittacosis or ornithosis, or Castillo fever. This one try to cause here pneumonia and eventually also fever of the unknown origin. The best way to diagnose this one is by exposure, history of exposure to the birds. And at the same time, could also have here your antibody. Serological test with antibody titer of 1 is to 32 will diagnose here an acute infection. Okay, now we go to your Rickettsia. So these are actually arthropod-borne. They are transmitted here by your vector. And there are also obligate intracellular parasites just like our Chlamydia. So we divide this one into your spotted fever group, typhus group, and we have also here your scrub group. Okay, and their triads of symptoms includes here the fever, there's a rash, and there's a headache. Okay, we discuss first here your spotted fever in a group. So this includes the following. The first one, Rickettsia acari. Try to cause here your rickettsial pox. This is characterized here by the presence of the rash, primarily on the face, in the extremities and trunks, but not on your palms of the hand and soles of the feet. This one is transmitted here by the bite of your mites stick na sugars. The next one, we have your Rickettsia conoriae. That one try to cause here your Botonius fever or your Mediterranean fever. So this is characterized here by the presence of the rash, primarily in all parts of your body, your face, your hands and soles of the feet, and also characterized here by the presence of the black spot on the site of the lesion. You call this one stash noir, where it's characterized here by drying up of the lesion. We try to produce a black center or black spot. And this one is also tick-borne. It resembles here your Rocky Mountain spotted fever, only that you have a rash presence on your face. But your Rocky Mountain spotted fever would have here no rash on the face. Okay, we have here Rickettsia. Again, this one causative agent of your Rocky Mountain spotted fever is also a tick-borne and considered to be the most severe form of your rickettsial infection. And the rash here could only be found on your palms of the hand and soles of the feet. So it's not present on the face of the patient. Okay, the next one we have here the typhus group. So this includes here the species of your the first one, Rickettsia prowazekii. This one is your epidemic typhus. That one is transmitted here by your lice, louse-borne. So get affected by that one by the bite of the louse humanus, pediculus humanus, and try to defecate. So sa fecal sample ng ating louse ang ating bacteria for that. If you try to scratch that one, it could enter your the bite, and eventually it could enter your body, and of course it would try to cause an infection. Okay, so one manifestation of your prowazekii would be the recrudescence or the reactivation. And the cause was your Brill sensor disease. And the rash here could be identified on the presence of your palms, of the hands and soles of your feet, plus also try to develop here on your face. Rickettsia typhi is another one. This is your endemic typhus. And it's transmitted here by the flea, rat flea. So nasa fecal sample din niya. And at the same time, this one also called here your murine typhus. So this is identified here. Most likely the infection did not produce the rash. In some occasion, it might be developing here only on the trunks and your extremities. But most of the time, wala talaga siyang rash. Okay, the next one, we have here your scrap types. This is your Orientia, Chuchugamushi. So this try to cause your scrap typhus. It's also characterized here by the presence of your black spot, your tache noire, the same true with your conoriae. And the rash here is only limited to your trunks. It starts with your trunks and try to spread to your extremities. It could not be found in your face. It also could not be found in your palms and soles of your hands and feet. Okay, so it's transmitted here by the bite of your Shiger's mite. Okay, now we have here your Rickettsia, Anaplasma, and Rickettsia. So the first one, Rickettsia shapiensis, is causative agent, the human monocytic ehrlichiosis. Ewingii, Ewingii, try to cause here your human granulocytic ehrlichiosis. Then we have your Anaplasma, phagocytophilum, try to cause here human granulocytic anaplasmosis. And Rickettsia fever is caused here by your Rickettsia sinetsu. Okay, next we have here your Coxiella. So Coxiella do not belong here to any of your Rickettsial na classification. So that one is not arthropod transmitted. Coxiella burnetii try to cause here Q fever, and we consider this one as highly infectious. It's an agent of your biological terrorism. You can infect it here by inhalation of the infected na breathing fluids, or even by ingestion of your unpasteurized milk. So laboratory diagnosis here for Rickettsia infection. So you could have your histochemistry or immunohistology with the tissues here by identifying the infections. You can have your PCR, nucleic acid hybridization test. But we have also here, you can have also your peripheral blood or buffy coat stained here with your gems or right stain. The best culture media for allowing them to grow here would be your embryonated egg or even your tissue culture. Then you could have your punch biopsy of the skin and eschars. Then eventually you could have here your anticoagulated blood as your specimen for that. Okay, then we have here your Weil-Felix reaction. So Weil-Felix reaction is a serological test. This is a agglutination test where you're detecting for antibody. However, the antibody that they are producing try to cross-react with your Proteus. So, hindi siya ganun ka-specific na test. So, you are using here your reagent antigen coming from your Proteus vulgaris, which includes here the OX19 and OX2. Another antigen here would be coming from the Proteus mirabilis, the OXK. Again, you are detecting for the antibody. Okay, so we have that one, Brill sensor disease. Again, this is causative agent of this is your Parasites. So it would have a variable result, negative for that. Epidemic typhus is also for the Parasites. Murine typhus is also for the serotyphi. Rickettsial Baxter Akari, that will have here all the negative results. Rachimanas by fever caused by Rickettsia. Scrap typhus is your Orientia Chuchugamushi. And we have your Coxiella burnetii ehrlichiosis here would have all the negative results with your Weil-Felix reaction. Okay, next we discuss your Mycoplasma and we have your urea plasma. So these are molecules. So the molecules here are actually made up of our bacteria, which they do not have here the cell wall at birth, or permanently they do not have the cell wall. We call them here as our cell wall deficient bacteria. Again, it could be differentiated with our L forms because the L forms do have cell wall, only that's being lost here because of exposure to your environmental conditions. But in the case of your molecules, eventually they don't really have the cell wall, making them resistant here with your penicillin group of antibiotics or even cephalosporin, because those are the antibiotics which has their effect is directed towards your cell wall. Since bacteria do not have the cell wall, so it will not be effective. Okay, so they are slowly growing the bacteria except your Mycoplasma hominis, which is a fast-growing one. All of them are facultative anaerobes except your Mycoplasma pneumoniae because this one is aerobic. Then there are also fastidious with a special requirement for their lipids or fats in the form cholesterol or your fatty acids. In a solid in culture media, most likely they tend to grow here at the edge of the colony and therefore it would be difficult for them to pick up. And usually they appears to be raised, umaangat ang kaniyang colony characteristic and would resemble here our fried egg appearance, especially for, we're talking about your Mycoplasma hominis. So there are also normal microbial flora found in your oropharynx, in your upper respiratory tract, and in the lower genitourinary tract because they could find them in the upper genitourinary tract as being pathogenic. You can find it here by, okay, so sexual in the case of your Mycoplasma hominis and your Ureaplasma urealyticum. Respiratories with your Mycoplasma pneumoniae. And then, of course, the fomites. But first, we discuss your Mycoplasma pneumoniae, so it's being transmitted here by respiratory or even your fomites. Try to cause here your atypical pneumonia or your walking pneumonia or Eton agent. Eton agent here is actually, I think this was the name of the person who tried to discover this one. So this one, bacteria has been isolated before in the cow. They call this one pleuropneumonia, try to cause pleuropneumonia. And later on, they try to isolate one in the human. They call this one pleuropneumonia-like organisms. And eventually become your Mycoplasma pneumoniae. Again, this one is a atypical pneumonia because this is milder, affects the young adults, and seasonal. Because most likely, if we talk about your typical pneumonia, which is caused by your strep pneumoniae, that one is severe, that one is affecting adult population. Okay, then we have also here the species we try to cause here urogenital infection. So basically, they are transmitted here by sexual contact or even transplacental, your vertical transmission. So when the mother is infected in during the delivery or during the pregnancy, that could pass the infection here to the baby. So this includes here your Mycoplasma hominis. Again, this one is normal microbial flora found on the lower genitourinary tract. But in the upper genitourinary tract, I try to cause here the following infections. Try to cause salpingitis, pyelonephritis, pelvic inflammatory disease, and your postpartum fever. Your ureaplasma, urealyticum also try to cause here your sexually transmitted urogenital infections, including reproduction disorders, chorioamnionitis, congenital pneumonia, and chronic lung disease, especially for those mga sexually active young women. Okay, we have your specimen collection. So the specimen can be coming from various body fluids, including your blood, CSF, could also have your sputum, synovial fluid, CSF, or even your urine wound aspirate as well. So the best for this one is collect the specimen at the bedside because they are prone to drying. You can have a culture media SP4. The SP4 contain the following. It contains here, number 1, sucrose phosphate buffer. Would have the Mycoplasma base, 10%, 20% or serum, and also contains here your neutral red as the indicator. Why are we needing the indicator? Because again, they try to grow in the culture media as colorless. Or most likely, they are not producing turbid na solution, so we could not recognize if it's why there's a growth or without a growth. That's why we are adding an indicator for you to check if there's really a growth of this bacteria or wala. Another one, you could have your Shepherd's 10P arginine broth here for allowing you to check if they try to utilize your arginine in the case of your Mycoplasma hominis. Then we have also your 2SP. Okay, so when you're collecting the specimen, if you try to swab, so make sure that try to use here the swab made up of your calcium alginate or your Dacron with not your cotton tip na swab. And the shaft, ang handle niya na dapat should be made up of aluminum or even your wooden. That because of course that one will not be toxic to your bacteria. Okay, so we have culture here. So SP4, so you can identify the growth of your Mycoplasma pneumoniae by your glucose utilization because it one requires glucose for the growth, producing a yellow color. Your Mycoplasma hominis, on the other hand, could be with your arginine production here that will change the indicator color here to become alkaline. So pag may alkaline production, it will change the color of the indicator to be deep red in color. So that's positive for the arginine, and arginine is a growth requirement for your hominis. And urea, in the case of your Shepherd's 10B arginine broth, I think this one could also identify this one. Or even your urea utilization. Okay, that would have increased in pH, producing a deep red color, identifying your urea plasma, urea liticum, because this one is the only one requiring urea for as its growth requirement. Okay, recovery of the bacteria in the blood culture. So you all you need to do here is just your blood should not be put on your anticoagulated na blood collection tube. So approximately 1 to 10 ang ratio ng blood natin with your broth medium. So but you are required to have here at least 10 ml of the blood. I mean to say dapat 100 ang broth culture medium more for that. The SPS content with our blood culture tubes, okay, is inhibitory to your mycoplasma. So you can add 1% gelatin in order for that not to be inhibitory to neutralize the inhibitory activity of the SPS with our mycoplasma. Okay, of all our species of the Mycoplasma and Ureaplasma, so only the hominis were able to grow here in our blood agar, sheep blood agar, and chocolate agar. So your pneumoniae and even your Ureaplasma, Urealyticum would not able to grow on that. So in the SP4 agar, okay, that would eventually allows the fried egg appearance manifestation of your M. hominis. That could be visualized by adding stain with your black of your agar. You put it on a slide and try to put on your stain. You could have your methylene blue or you could also have your diins. So dark color here at the center and light color in the periphery that gives a characteristic na fried egg appearance. Again, for the growth requirements, so again, your hominis requires arginine, pneumonia requires your glucose, and ureaplasma, urealyticum requires here your urea. Okay, so that's all with this topic. Okay, thank you.